Hi, good afternoon, everybody. It's another Friday Live afternoon. Today, we've got another health coaching event. We had the first one of these, I think maybe 6 weeks ago, and it was a really, really good and successful event. So I think we're going to have a series of these. Today's one I'm really excited about because anybody that knows me knows that I really drive home the importance of speaking to people. I'm trying to avoid the word frontline these days, but the people that are closest to the work and to patients. So today's session is going to really focus on that, and we're going to hear from the people closest to the work and from patients as well. So in a second, we'll just do a quick round robin introductions, and then Isabella is going to talk us through and kick us off with some slides. But most of this is going to be engaged dialogue where we can really speak to each other and listen. If you can, in the audience of LinkedIn, if you can type in your comments in the LinkedIn chat area, the comments area, we can see those, the panel can see those, and we'll respond to them as we go. So really encourage you to get involved and ask as many questions as you want to. So I will kick off. I'm Anthony Lawton from Fit to Care and Insight Genie. My mission is to reform public services. My big drive is cognitive science, behavior change, and AI in order to do that. And I'll start with Elaine to go next. She's clockwise on my screen. Over to you, Elaine.
Hi, I'm Elaine Cross. I'm a patient with type 2 diabetes and various other things. I've been involved in a project in Sheffield to help other patients like me, which has been quite successful in terms of peer support. And I'm also a peer leader with NHS England, having completed the peer leadership development programme.
Brilliant. And then over to you, Frank.
Yeah, I know Elaine very well. We worked together at their peer support Healy Plus in Sheffield. I also suffer from type 2 diabetes, and I help with my shared experience of reducing my medication, and I also have prostate cancer.
Thanks, Frank. And then our third person from Sheffield, over to Lee.
Yeah, you've got a contingent from Sheffield here today, haven't you?
Yeah.
So yeah, my name's Lee Vaughan. But my background is I've lived with persistent pain for over 3 decades. But now I've been on quite a journey, and I'm learning to use the very thing that's tied me down and held me back for over 3 decades as my greatest asset. Working as a health coach, working in the communities, developing peer support groups, and running chronic pain programs, movement programs all over Sheffield.
Brilliant. And then Sheila.
That's so good to hear, and great to be here today. So hi, everyone. I'm Sheila Kassan Marshall. From a patient perspective, I was diagnosed with breast cancer 7 years ago. It was an aggressive form of breast cancer, but caught early, but it did mean I needed a mastectomy. I chose to have reconstruction, chemotherapy, radiotherapy, and targeted therapies. That led me at the end of it, when there wasn't a pathway that would enable me to be rehabilitated. That led me to change careers from being a civil engineer to founding a healthcare company. Similar to, as Lee described, supporting people to overcome their chronic illnesses.
Brilliant. This is going to be a really good session. I can feel it. I can feel it in my bones. And then over to Isabella.
Hello. Hi. Thank you. So I'm Isabella Natchins. So I'm the CEO of the UK and International Health Coaching Association. I'm also a registered health coach, and quite simply passionate about the role of health coaching and the value of it to support people to make the changes that are important to them to support their health. So with that, Anthony, shall I attempt to start the slideshow?
Yes, please.
Okay. I can't see how. Okay, this is stopping screen sharing. Maybe I need to do that. Start again. So we're getting there.
Yeah. Hopefully it'll pop up. I've got them ready if you can't share them.
Yeah.
There we go. It's come up.
Oh, lovely. Thank you very much. Okay, it needs to be a bit bigger for me, so let me put full screen. Okay, so this is us maintaining the momentum for health coaching. So, you know, my colleagues and friends here have already introduced themselves, which is wonderful. Thank you for your time and support here. You are such an important element of what we do, because at the end of the day, you're our clients, you represent our clients, you represent patients, and that's so undervalued, I believe, in the healthcare space, and we need to change that. So we have a project, a movement, very much with Anthony, and thank you, Anthony, for facilitating this movement called Maintaining Momentum for Health Coaching. And we are, as he said, going to be a monthly. Just trying to move. I can't move my presentation on, Anthony, so I think maybe you could share it for me.
Yeah, no problem. I will bring us back and then can close this one down, and then I'll bring this one up. Excellent. I'll put us to the right. Actually, we're probably better across the bottom, aren't we? Can't see the slides as clear. That's better. Okay, slide.
Thank you. Okay, so we are going today, as you've heard, exploring real stories and the real impact that health coaching has had for people living with these conditions that are no joke. So much of our population now, 1 in 2 of us will get a cancer diagnosis. The other 50% will be their carers. 1 in 4 of us are living with a chronic pain condition, 1 or more chronic pain conditions. This all is impacting not only on us as humans and on our quality of life and our hope and our future, but our families, our communities, society, the workplaces. So it's so important that we get this right going forward. Next slide, please. So next slide, because we've seen this. Yeah. So why are we? Health coaching transforms patients' healthcare, their experience. It shapes their health outcomes. It helps their confidence and quality of life. And most importantly, it empowers individuals to take control of their health and their well-being, to be the active participants in their own care, not the reactive recipients of their own care. Next slide, please. So our approach, it's not about, as guys here will attest today, it's not about giving directives, giving advice, telling people what to do, intervening with treatments. We might if we've got additional scopes of practice, but it's about a person-centered, evidence-informed approach that helps individuals navigate their lifestyle and behaviour changes in ways that matter to them. Next slide, please. And it's a professional discipline. So health coaching is a growing and vital influence in modern healthcare. Our full members and our registered health coaches have international recognition for their training, for their standards, and for their scope of practice. So anybody thinking to work with a health coach or wanting to work with a health coach, please go and look at our website at UKIHCA and go and have a look at, contact your GP, your PCN, to see if there is an NHS health and wellbeing coach in your area, in your practice, in your PCN. And if there isn't, demand that they should be. Next slide, please. Okay, so this is the last slide. So I just to run through, thanks Anthony, you can take that down. And we will carry on. Why are we here? To hear from you guys. So the format for today will be that in turn, I'll ask each of my colleagues here a little more about themselves and their backgrounds, their health conditions, perhaps if they want to share, and what led you to seek advice and to seek health coaching or to find health coaching? How does your experience of coaching differ from regular consultation with your healthcare provider, your GP, your nurse, your consultant? What it was about health coaching that you found most helpful and why? Your thoughts about the benefits of health coaching for everybody, not just the few that can afford to pay or that are fortunate enough to have an NHS health and wellbeing coach situated in their surgery or PCN. And your ideas, and this is for Anthony, on how health coaching could and should be made more widely available throughout the NHS, to have that bottom-up frontline perspective and influence on the way we do health and medicine in the UK. So shall I start with Elaine? Tell me a little bit more about your background and how did you get to health coaching and what was different about it?
Gosh, I've come at it from several different angles. One is having direct experience of it myself. And in two ways it was delivered, one through a health and wellbeing coach and the other through a healthcare professional, a diabetic nurse doing a diabetic review, who used those skills in the interaction that she had with me. And that was revolutionary. Having the time and that approach meant that we could have an honest discussion about the things that I felt I needed. And that led me on to an exercise group in the practice, and then we all went as a cohort to the local gym, something I'd never think that I would ever do. So that was one part. The other was at a later date needing a bit of help really with sorting out things in my head. There's a lot happening in my life and just wanting to kind of clarify my thinking. Having someone who has these skills to help me do that was really helpful to me. She had the time, I had the space, and it was a journey together. Ultimately, I was taking control of my particular situation, and it helped me then to better self-manage my condition, and I didn't look back really. So that's how health coaching, I think in its broadest sense, not just in terms of the qualified coaches themselves, but also having that method of interaction by healthcare professionals within the NHS can make a difference. Do you want me to stop there, or do you want me to go on with? I'll stop there.
Shall we see what Frank? Do you recognise anything?
I was just thinking, Isabella, shall we all just have a quick whiz round just to reflect on that? I think that'd be really interesting.
Yeah. I think if we do, it will bring the same question for everyone, really. Yeah. Frank, would you like to?
Sorry, did you say me?
Yes, please.
Yeah. Sorry. Well, I know Elaine very well. We worked together at their peer support group in Sheffield. And I have a similar story to Elaine. And we've worked together for quite a long time and picked each other's brains and sorted things out in tandem with the healthcare people as well. So I don't know if I've got much more to say about that.
You talked, Frank, to me when we spoke on the telephone the other day, just to say hello, that your lifestyle has changed quite a lot. From when before you had. Yeah. Do you want to tell us a little bit about that?
Yeah, I had an unhealthy lifestyle as a truck driver. I was diagnosed with type 2 diabetes in the late 90s, and I ignored my symptoms for many years, but then I was prescribed with increasing amounts of medication, including injecting insulin. I was told that these injections would last for life. But after reading a report from a Professor Taylor about following a low-carb, healthy-fat diet, I could reverse my diabetes. I followed this diet, and then I met an inspiring doctor, Dr. Ollie Hart, who through health coaching and social prescribing helped me to lose 7 stone, which is 44 kilograms, about 8 inches off my waist. And after 10 years, I did come off injecting insulin, which I was told years and years ago that I would never achieve. I don't know if you want me to go on. He was a really inspiring doctor. He asked me a question which was probably the most important question I've ever been asked in my life, and that was what mattered to me. I told him that I wanted to live long enough to see my grandkids grow up. The eldest is now at Newcastle University, studying medical degree. So I've partly achieved that. It's also made me very more healthy, by starting up a cycling group. Is that enough? Do you want me to pass on to someone else?
Yeah. So I think we can scrub the idea that you hadn't much to add, because I mean, hats off, Frank. Absolutely hats off. Okay, Lee, so I can see you next on the screen. So maybe you can. I'm sure you've got a lot to add from a slightly different perspective, but please share.
Yeah, I suppose it is a different perspective, isn't it? My background, as I alluded to, was this 3 decades of just living with pain and fatigue and everything else that comes with that, and very, very little in the way of an answer. No evidence of structural diagnosis in MRIs or X-rays, scans or bloods. And in January 22, I find myself signed off work, and I was staring down the barrel of ill health retirement at 47, just in inexplicable levels of pain in the darkest period of my life. And I was taking 28 tablets a day for that, which was a situation that I found myself in. If you remember Woolworths, I'd got the pick and mix of medication. I'd got everything. And I suppose in terms of health coaching, I didn't seek out a coach, but very similar to probably Elaine's story, actually. Was I fortunate? I was triaged for the pain management program in Sheffield by a brilliant clinical psychologist who I now, on reflection, see met me as a health coach in that room. She just met me where I was at. She gave me 90 minutes to sit and to talk, to tell her how I feel, to tell her my story. And that was the interesting thing in telling that story, because as I told that story, it was the first time I heard it too. And that was incredibly powerful and incredibly cathartic. And I think it started to open doors for me. And I know Ollie Hart too, same as Frank, same as Elaine, has been incredibly inspiring individual in my journey, a great mentor, just a great guy and friend. And I use the word an awful lot in terms of curiosity. I was just made curious about this possibility that, everything I knew, everything that I believed around pain, could be different. And when you're rock bottoming in a place like that, as I was, that lady changed things for me. And all she did was listen.
Brilliant.
Yeah,
Isabella, we've just had a comment from the floor, from the chat in LinkedIn, so it might just be worth pulling this up now because it's completely relevant to Lee's point. It's more in your camp than mine, this one.
Oh, I know. I get to, I get to a few times. Because I now with Ollie Hart, I now get this, you know, a guy that's lived with pain for 30 years is now delivering pain education to healthcare professionals, you know, in a training environment and in a coaching environment as well. And I get to say, I've approached a few GPs with the idea of working together, but sadly they weren't open to the idea. And I'd appreciate any advice as to get into the circle. And I recognise that, and I'd be interested in hearing from healthcare professionals or from GPs that are resistant to that a little bit, as to what is that resistance? Why is there that resistance? Because I work with Ollie, we co-present pain cafes, we co-present pain education, and it's gold dust.
Yeah,
Brilliant.
I agree. And I've recently, last year, did a training day at the National Centre for Integrative Medicine down in Bristol, and it was around chronic pain conditions and the power of health coaching. And there is such a lot of development in this area, such a better understanding of what it means to manage and control pain. I would say reach out to Lee. Reach out to Lee. If you don't mind, Lee, I'm sure Anthony will put your contact details in the chat. Reach out to me. Reach out to, actually, reach out to me, because pain cafes now are popping up all over the place. And they really are, you know, just a hugely compassionate solution that's informal and very, very effective to support people to get the confidence. I've referred a few people I know personally to one that we have quite near us, and they've benefited hugely from that. So please reach out. And, you know, the idea of GPs, you know, GPs need help too, to understand what's available and how the landscape's changing in this area. And we're very, very happy to help anybody do that. So thank you.
I'm mindful that Sheila hasn't had a chance to speak,
Yeah,
but I just wanted to come in kind of very quickly on this point. One of the things that Frank and I have been involved in is developing patient-led education courses, and we've done it within our primary care network. And one of the things that we were concerned about is actually getting to patients to kind of sell, if you like, the idea of what we're doing. And what we did is we're doing roadshows around the practices within our primary care network. In the past, Ollie organised a meeting in his practice for diabetic patients to come to get people involved. So I think, Agatha, there might be other ways of perhaps approaching it. Plus the fact that if there are people, please contact me, because I'm part of the NHS England Peer Leader Network, and we have people like me all over the country doing things. And there might be somebody in your patch, a patient, who might be interested in helping you.
Brilliant.
Okay, so if you could both then put your email contact in the chat, so that anybody that's interested, other listeners, or if you're not sure how to do that, Elaine, I'm sure Anthony will help you. And let's conversation, and you know, we've started it, let's keep it going. Sheila, let's have your perspective, because yours will be quite different from everyone else's, which is why it's so valuable to have.
Thank you. I have to say that sitting here in, you know, the stories from Elaine, Frank and Lee, it's very hard not to be deeply, profoundly moved by that, and the amount of change that we can generate ourselves from being supported and being heard. I think, you know, that and I loved it when Elaine said, I circled the take control. You know, you were given the skills to take control. And Frank, when you had the education piece and the papers that you found around research, it was about how you applied that research and lost a colossal amount of weight and reversed your diabetes. And it's just, I mean, it's literally, it made me choke up a bit to hear it, because we all know that this is the power of what we're talking about. And from my perspective, I was early 40s, and my babies were 1 and 2 when I was diagnosed with cancer. with breast cancer. And as I said, it was an aggressive form. It was the language. I'm sure this happens to everyone, but I was quite surprised. I didn't really know an awful lot about cancer treatment, I guess. And when the language was all around, we will try this therapy, we will try this and try that. And I thought, Christ, why are we trying? Why isn't there just an answer? And I do this, that, and then I'm better. But of course, it doesn't go that way. So having had my chemotherapy and then on to mastectomy and the radiotherapy, by the end of all of that, this side of my, so it was this side where I had my mastectomy, and the wash of radiotherapy just tightened this shoulder to such an extent I could barely lift my arm. I couldn't lift my own children. And I was so, frustrated by that. So I thought, and it would have been a 14-hour surgery. So it was a hell of an operation. And I thought, I can't live like this. I can't live now disabled with one and a 2-year-old. So I went actually back to the Nuffield, and they have hundreds of gyms across the UK and, hospitals, cancer hospitals and things where they do all manner of things, but including cancer. And I spoke to one of their specialist nurses and said, I'd gone to the NHS and said, where do I go now for my rehabilitation? Because I just sort of expected that it was going to be there. I would be sent to somebody who could recognise that I was profoundly impacted in a very bad way. And psychologically, I felt totally broken. I had a complete fear of, I couldn't drive past the hospital because it was like the site of the trauma. So I would go 20 minutes out my way to avoid even seeing it, talking about it. And when I reflect back now, I'm sure there were signs of PTSD in that, because I was absolutely blimmin' traumatized. So I just realized that I really needed help. But the answer was, come and join a group-based session. They had a little bit of funding in my local hospital. They're an excellent hospital. I don't mean this to speak ill of them. They do have a program, but that program consists of everyone coming in and being told, you need to do some physical activity and do these stretches. And they demonstrated half a dozen stretches, which is better than some hospital have. But I thought, and I kept saying, it's not enough. We need more than this. We need so much more, because how do we recover without that specialist skills that a physio or a health coach could provide us with? So that was what then led me to sort of saying, okay, well, I'll find a health coach, understand how that works, understand the physio side of things. I read a load of research papers about what was going on in Australia and this term exercise oncology, which was to promote rehabilitation post-surgery. And for swimming, one of the things it mentioned is that with really understanding the backstroke and how to do it properly, so I took swimming lessons as an adult, then you get the complete return to mobility. So I was told I would never get this return to mobility and just accept it. And I have 100% return to mobility. And so it all worked for me. And when it worked for me, I then set about, how do we turn that into a course to deliver to women who initially it was for breast cancer. So we put on in a local gym weekly sessions over 12 weeks with a health coach trained in level 4 cancer care, and the dietary advice. I mean, from a dietary perspective, I was being told I'm being pushed through a chemically induced menopause 10 years early. And it was like, bam, being hit by a bus. And it wasn't just me being hit by a bus. I think my husband was hit by a bus, but with this sort of rage that would, every time the heat came, the rages came with it. And so whatever goes on in normal natural cycle of menopause, it was really intense and terrible. And I had nothing to support me or even understand what to do about that. So there was all of that stuff. So we were delivering in our 12-week programs, and we set them up just to see how people would respond to it. Menopausal support, dietary advice. I was being told I was going to lose bone density way faster than somebody who hadn't been pushed through this early menopause. And I thought, well, how do we recover bone density? Of course, it's weight-bearing exercises, it's dumbbells, it's kettlebells, it's working out in a gym. And the thought of going to a gym floor with a bald head and a scabby body post-treatment, and all my skin was so raw. and I'd lost all my fingers and toenails, and I couldn't even imagine anything worse, to be frank. So I certainly wouldn't have had the confidence, and I assumed the gyms were filled with the beauties and the, you know, the skinny ones and all the rest of it, and all the beefed up ones, and I just didn't feel like I had a place there. So this program sort of allowed me and the people around me to come together and recover and learn the techniques that we could put into our lives, as well as looking at our diet and as everyone alluded to, everything we could to take back control. But the one thing I hadn't realized that we found out on surveys, as well as these groups in, you know, increasing quality of life, reducing levels of stress, anxiety, depression, PTSD, I also discovered from the other women I'd met in the early days that the biggest, most profound impact of working together on these, being health coached and working together, was each other. Because in having each other, we are heard, we share tips, we understand what works for other people, and we're in a community, probably one that, you know, in the cancer case, you would never want to join, but when you are in it, you have this amazing system of support. And so it was, for me, you know, just a joyous thing to be part of that. And that then led us to developing our chronic pain program. And as Lee described earlier, I think there is so much in that, in terms of the being heard, the 90 minutes to be listened to, because most people have been all around the block and told everyone and be re-traumatized. But for somebody to actually hear is such an important thing and a skill, and something that I think from a health coaching perspective, we do amazingly well. And, you know, Isabella has been a joy to work with as Deepak and I have built our company Butcher's Bear, and we learn so much because we're a great community all delivering in the same circles. So yeah, that was my experience, and I feel like I'm doing good. You know, post cancer, there's still some symptom side effects, but I feel they're manageable. And on the whole, and I would say as well, of course, I think we've all mentioned it a little bit, but it's a complete symbiotic relationship between our mental and physical health. So we can't go through all of this without it taking a toll in us and make us want to make changes. So recognizing that in our recovery is really important, I think.
Profound stuff. Isabella, do you want me to do a reflection? Because I think I've just had a bit of a eureka moment.
Yeah, please. And yeah, please do.
Okay, great. So obviously my background and where I'm coming from with all this is system change, you know, pathway change within all hospital services and social services. And I think the two things have just completely combined in my head in terms of the key concepts. So getting things right first time, but I've written down here the human journey. And there's real consistency with all of you guys around that human interaction. And Lee's point around, that's the first time that story's been told, even to myself. You know, that to me completely ties in with getting things right first time, and having that human touch and the time to get things right first time is incredibly powerful. And for me, and what I've been writing about, is the NHS, and I think all social services, are been forced down a sausage making machine of in, out. How fast can we get you in? How fast can we get you out? How fast can we get those waiting lists down? And because of that, we're missing that human connection. And this ties in with human learning systems as well. If any of you guys have not looked into that yet, I'd really recommend researching those guys, Professor Toby Lowe, and it all ties together. Because as soon as we do ask the right questions and we do invest the right time right at the start of these journeys, so instead of telling Frank that you're never going to be off these injections, instead of telling Sheila you're never going to get that movement back, we spend some proper time, like the 90 minutes Lee's example, really understand what's going on, really put that investment in, create those human connections, create the contact, the right information. The difference is unbelievable. Because if we now look at the system perspective and understand all the failure demand that you guys will have experienced through not getting that right first time, the pressure that then puts on the NHS and all the systems is immense. So we just end up becoming busy fools because things aren't right first time. You end up going to the GP 10 times more than you need to in the next 12 months. And because you haven't sorted this out right at the start, you end up going to A&E 3 times more than you should have done. And everybody's miserable in the process. So that, for me, is the eureka moment of all these things are connected, and we've got to get it right first time, which means humanity and time right at the start. So I don't know if that ties in with you, but it was really profound for me. I think listening to your stories is really powerful. Ultimately, we need to do a lot more of this stuff.
I think, Anthony, you've touched on something there that's really quite important, and that is that when the voice of people with lived experience is heard and treated as an equal point of view in terms of determining provision, it makes a huge difference, because there are pockets of really good practice along those lines going on throughout the NHS. But I've also seen, like you've talked about, the 10-minute appointment with the GP and you can only talk about one condition. That's why having health coaches based, in the R's roles within a GP practice make a huge difference in terms of the support that patients can access. We all know that because we've experienced it, and it's how do you then change the culture? That is slow, but I think there is a move towards having the more centered, patient-centered care, because you're looking at the whole person. How many times do we talk about looking at the whole person? I think every one of us has probably been in that situation. We're talking about, we need to look at the whole person. And in the work that Frank and I are involved in, dealing with other patients with type 2 diabetes, the light that comes into them when we start talking in those terms and talking about recognizing the lives that they lead, and health and well-being coaches are extremely well placed to do that kind of work, and it's actually very necessary. And I wish that other healthcare professionals could see that this is beneficial to them. Getting patients to have the shared responsibility, improving their self-management. It makes it good for everybody. And this is certainly the message that I think all of us here are trying in our different ways to get across.
I think this is a good segue for us. This I don't know who sent this one through, but I think it's a really good point around educating GPs. I don't want to be a GP basher, because I think they've got a really, really difficult job, and there's more alcoholism and suicides and such like in primary care, and that's only getting worse. So we absolutely can't bash primary care. But I guess that's where health coaches can support and take some of that pressure off, isn't it? But hopefully this sort of a session can get people to see, no, we've got to remove the pressure from primary care so we can do things properly and get it right first time.
And actually, I feel I must come in here and just talk about the role of health coaching in society generally. And health coaching doesn't have to be delivered just by professional health coaches, but it's a discipline, it's a modality that we as humans and peers towards each other can effectively support each other. But we do need to have a little bit of education and understanding about how to do it well. So it's not just as a peer to peer, oh, this worked for me, you try it. So it's not about that. Coaching has tools, techniques, it's a process, it's an approach that opens doors for people to think for themselves, think about what's good for them, where they want to start. So everybody, any healthcare professional, whether you're a surgeon or a nurse or a GP or a consultant or a physiotherapist or a nutritionist, everybody can benefit from health coaching skills. And at the association, this is one of our, pillars of our constitution, that we are there to promote and to advocate and to broaden the perspective of all healthcare professionals, and indeed other sectors in the, physical activity sector. You guys, with the Nuffield clinics, everybody has a role to play. to help coach each other in a meaningful way. But what I really want to raise here is, make no mistake, health coaching in the NHS is vulnerable at the moment. We have, I think, in excess of about 1,000 health coaches in place, remunerated by the Additional Roles Reimbursement Scheme, ours. We know that there is a lot of change happening at the centre. We know that NHS England is about to change its whole face. We don't know what that will look like going forward. We know that the funding to ICBs has been cut. We know that GPs are under pressure, that general practices, that everybody is fighting for a bit. We know that the GP contract has broadened the categories of staff that can be included in ours. This has made a situation that's already bad worse. And we have to fight to keep health coaching in the NHS. We have to fight for those thousands, well, a good 1,000 of NHS health and wellbeing coaches who are remunerated, who have been trained, who have a passion for what they do, as people here have attested. We have to fight for that. We have to fight for the right for our patients to be heard. And we know that GPs are overstretched and overwhelmed. We know that in secondary care, consultants, and we know that people in the PIFU, the pathway that is post surgery, in the PIFU pathway, that patients can be really helped in the patient initiated pathways, to be supported by health coaching when they're as outpatients, to decide whether they need another appointment or when they need it. So I want everybody that's listening to this now, that will listen to it as it's restreamed, to bear in mind that if we want health coaching in the NHS, if we want the power of this evidence base, it's a global evidence base. It's not just the UK. It's everywhere, and it's in every sector, and the evidence is strong. The modality is not difficult. We do need to help each other as peers, as clinicians, to learn coaching skills, but we need a hardcore base of professionally trained health coaches to support every level of healthcare. We need them in the physical activity sector. We need them in workplaces. And my goodness, we need them in schools and places of education. We can't expect doctors to do all of that. We have to help them. So if we want to support the overwhelm and the job satisfaction and the outcomes that our medics and our clinicians get for their patients, we have to educate them to the value and the understanding of how a health coach is going to change their experience of delivering healthcare, and how their patients' lives, qualities of life, experience of healthcare, being listened to for the first time, being given an opportunity of voicing what's been inside them all these years, but they've never found the voice, had the words to have the time or the opportunity to express it to a very caring GP or nurse or other clinician, because the system is not there for that to happen. So please help us maintain the momentum. And, if it's going to be, it's up to us. Yeah. Yeah,
absolutely. I've just pulled this comment up from Ethel, which I think is really relevant. Interesting for me, this one. I joined the NHS for a 3-month contract just to bring business cases from the private sector into the public sector. This was in 2007. And I was shocked by how much focus was put on treatment and literally nothing on prevention. I pitched an idea, a bit like a Tesco club card for health, back in 2008. It's a long story, and it didn't finally get off the ground because of politics and things. Maybe we should do a whole another Friday event on that one. But that was nearly 18 years ago, and we're still in the same boat. In my mind, we're still really not focusing on prevention, and when we have to, we can't. It's not sustainable without us really focusing on prevention. So I don't know if that's a thread that everybody wants to have just a round robin on, but yeah, really good point.
I think I would love to hear from you all what your understanding of prevention is, because I think there is a difference in how different people at different levels within healthcare understand prevention differently. So I'm going to save my thoughts till last, but I'd love you all to maybe share what you think is preventive, proactive care. Lee, I think you had your hand up. Yeah.
I did, yeah, and I'm gonna coin a phrase that Sheila and my good friend Deepak Ravindran uses an awful lot, which is we need to start going upstream. At this moment in time, the system we have, we're dragging people out of the rivers when it's too late. Yeah. 30 years I waited. 30 years. If we start, do you know what? And I said this recently about going back to the future. Because in days of old, when you go to see your GP and you got a good GP, you knew you were taking a picnic for the day, weren't you? Because you knew if you got a good GP, they were allowing 35, 45 an hour appointments because they were delivering this person-centered care, and it's how they did it. And I think the evolution in pharmaceuticals, now we've got a tablet to fix everything, is that's how we are reacting rather than this preventative stuff. So for me, prevention is about going upstream and about meeting people where they're at. And you made a great point, Isabella, about education in schools. That is a great place to start.
Yeah. Thank you. Frank, have you, as the last few minutes, left you with any thoughts and reflections?
Well, I think Sheila said one of the most important words, and that's community, because we've found out all the people that attend our sessions, we encourage them to bring family and friends and even kids if they want, and hearing their stories. And although Elaine and I have got quite a bit of knowledge about self-managing diabetes, we're still learning from these patients who tell us their story, quite emotional stories. And we're currently trying to encourage more peer support volunteers. We want as many as possible, just spread the word, really.
Thank you. Thanks. Elaine?
We could go on about this for forever, couldn't we? I think one of the things that our approach, Frank and I, we've been working together for some years, is that bringing people together in our education courses, because we have people who have English as a second language. You'll get grandma bringing granddaughter who can help them with the English. And then the granddaughter who hasn't developed type 2 diabetes, but is possibly predisposed to it, here's all the information, and then starts thinking, oh, I'm so glad I came, because I know that people in my family have it, I'm likely to get it, now I know what to do. So it's trying to find the ways of accessing people at younger ages, I think, which is not always easy, particularly given the way that people live their lives these days. But we talk about life enhancing activity. We try to make it positive.
And you've just hit the nail on the head effectively there, Elaine, because one thing to remember is that when we talk about prevention, a lot of the prevention that we see happening in healthcare at the moment is not primary prevention. It's still downstream prevention. it's earlier diagnosis, it's more effective testing, it's earlier referrals. So it's still waiting until that individual is either nearly in the river or just about to fall in the river. It isn't doing what you've just described, which is using each other in a ripple effect, using education, using understanding and knowledge to actually drop the pebble in the pond in communities and help the communities self-empower with better understanding, confidence and action that they have a legitimate role in their own health. So primary prevention is so important, and that's the whole piece before anybody even starts to get symptoms. And even when they get symptoms, we can still intervene to prevent a diagnosis. And with that, Sheila, what would be your thoughts around this?
Well, I mean, it's funny that you should say that, because I'm sat here thinking, Christ, you're so right. We hear this stuff all the time, and I hadn't even realised that what is being sold to us is we're already there. It's reducing it and catching it earlier. It's not actually preventing it. And it's only in you saying that I realised that if we all went digging now for a strategy on what exactly are we looking at from a preventative healthcare perspective, we're going to come up with nothing. And I think that it then becomes, it's almost a sort of, dare I say it, a class issue then, that those of us that can afford the time and the money to have lovely gym facilities and potentially through it being drummed into us in an educational background, may have some chance of providing that preventative healthcare stuff to ourselves. And then there's a whole piece of everybody else who doesn't, you've worked a 12-hour shift on your feet. The last thing you're thinking about is actually going to a gym and doing more movement, because in effect you've done it, but perhaps not moved your body in a way that's going to be totally beneficial, probably just compounding whatever's going on, like our healthcare workers. So I think it's a really valid point, and I think that absolutely getting in with the kids early. Do you know what the thing that always I'm so filled with disdain about is that when you see what our kids are given at schools, and you think, how are we still feeding them this rubbish every day? That they have, like, they go to their schools and it's chips, burgers, and then in the break time they have a brownie or a donut. And yes, there is a fruit option. So, if you ever challenge it, you'll tell, well, there is a fruit option. But if you hand a child a delicious donut or an apple, they're going to take the donut every time, aren't they? So this is sort of, and, the work that I guess Jamie Oliver and people have tried to sort of push into schools, there was some progress in that. But I don't think we've sort of fixed that, the ultra processed food and making children so aware. I've seen one example of a really interesting from a drug company. It was in Cambridge. It's a company, AstraZeneca. So they headquartered in Cambridge. It must be, I can't remember how many years ago, but it must be 7 or 8 years ago they built their headquarters. And in doing so, they really wanted to engage with the community. So they wanted to sort of push funding out. And part of that funding was working with the local football club. And they invited a load of school children in from the state schools in the local area. And they would sort of do some reporting on the match. They would put monitors on them, sensors, wearables, and do a load of exercise. And then they would talk them through what that was doing through the body. And then they would talk about, if you eat this bad food, this is what it's going to do. And it was really impactful for the kids because they could see it. And now, I don't think we know enough about how many of them have been profoundly long-term impacted, but that sort of stuff can only do good. And as you say, Isabella, there's very little by way of that. And if you're a child in school and you don't particularly like athletics, or you're not particularly sporty, there's a million other things that you could be doing to enjoy movement and getting fit and active, but you're probably going to fall out the system a bit. So there is really, and certainly as an adult who's trying to get into it, unless you are very lucky, probably very hard to walk through those gym doors, even in your community gym, and start it. And I think back to the point that everyone has made around community, I think if I was diagnosed with diabetes and I was told, look, there's this chap Frank, who was in your position, and he's going to come and talk about it and talk you through some exercises and his cycling group, then all of a sudden I can relate to it. And Frank has lived through the same pain barriers that I'm now in, and somehow he did it. So how the hell did he do it? And if he can do it, Frank can do it, then I can do it. And I think that's the bit that even from a preventative healthcare, we kind of need more of that stuff. And in the old days, I know it's a bit dated now. Obviously, I don't have any affiliation with this group that I'm going to mention. But, you know, in the old days, people would go to Slimming World as a way of sort of finding a community and working together to lose their weight, which, again, you know, an enormous part of that is preventative healthcare, losing weight, reducing risks of certain comorbidities and diabetes and things like that. So, you know, that's probably a little bit more 80s now, but new versions of a community where we can be working on our preventative healthcare together, I think would make an enormous difference. And I would imagine at quite a low cost, if it could be delivered in community halls with health coaches, this stuff could be done at a very reasonable cost. And I have seen some papers that we can share afterwards about the role of preventative healthcare in some of the Scandinavian countries and how they have tied that into the number of nights in a hospital bed, the number of GP appointments taken, and the reduction in those by putting in place community, fairly low cost preventative healthcare programs. And I think that there is pockets of research that says that could work. But also there are companies like the Wellcome Trust who have an enormous endowment financially. And I think there's some amazing, great, deep research that's going on there. But some of this stuff is sort of so obvious. I wonder why can't we get, you know, a kickoff of £10 million to do some studies to categorically prove the value and then get it rolled out, you know? So I think that with enough momentum and enough of our voices, we could probably put together a very compelling argument for some trailblazing style stuff like they've done with the Department of Work and Pensions, because they, of course, are citing 3.5 million of us economically inactive. We're talking about the biggest numbers of UK people out of work, highest rates of 16 to 24-year-olds, not in education, not in a work system. I had a meeting with the DWP earlier this week on Tuesday, and it's very, very clear that this needs addressing, and from a preventative healthcare, because a lot of the people we're talking about are young people who are falling out of the work system and the education system, and they haven't got this access to some form of preventative healthcare. So I think there's enough of us who could put together some really good arguments as to how we could do some paid pilots and trials and research studies, like a clinical trial on this.
Yeah, brilliant.
Yeah.
That time has absolutely whizzed by.
I mean,
it's almost 1 o'clock.
It is, but I think, Anthony, if I could just leave us all with that wonderful chat you've just put up, around prevention perhaps lies at the intersection of primary care, public health, community and employers. I'd say schools as well, the education space, and fill the space with health coaches. Well, LinkedIn user, whoever you are that offered that, you're absolutely on the money with that. So please help us maintain momentum for health coaching in the UK, because it really is the beating heart of the future of healthcare.
Yeah, absolutely. And Sheila, you were just talking about putting references to studies and things. I think it'd be great if we all put our contact details and any references and things in the LinkedIn area of the session. You can, after this event, you can go in there and add comments to it and add the papers and the references and things. That'd be brilliant. I think everybody then's got a place to go to find your contact details and such like. So brilliant. I wanted to do at least the same again. That's gone really, really quickly.
It has, hasn't
it?
Let's do another one in a few months.
Yeah, really powerful.
And see, let's just keep, keep on keeping on. It's like the broken record, isn't it? You know, unless we let them know we're there, people won't know we're there.
Yeah.
You know?
Right at the beginning, you asked me had to reflect on how we could, scale this and make it scalable and make a real impact and a real difference. And the one thing that popped to my mind, again, as we've talked through this as well, is for me, the big thing is listening really, really well. And how do we industrialize that listening process? And then the second one is communication. So that's really what I'm working on with AI, is how can we industrialize? So imagine listening to 1,000 Sheilas in a particular region and getting AI to collect all those voices and then coming back with a concerted, these are the messages from the 1,000 patients in Sheffield that have gone through the same as Sheila. This is the learning that we've had. And then flipping that and saying, that's the learning, and we can push that learning again through AI to people that really need to know what's going on. So the leaders in these health systems need to know this stuff. And there's loads we can do in terms of, Frank might have gone on to an AI platform that we've built the knowledge on. We've got a really robust knowledge base. Frank can put in his particular bespoke elements and get a really bespoke, refined, robust response, which will include, actually, if you went through your low diet regime, you could get off the injections within 6 months. And here's your community group. And there's so much we can do. So I would just say, if anybody's interested in the AI side of all this, then again, you can contact me for that bit of it. But it feels like we're on a roll.
And I was just going to say that just on that point, I was really struck with, it's everyone's story is so powerful. And just with Frank's at the moment, I just checked, there's 275,000 heavy goods vehicle drivers in the UK, approximately. Now imagine Frank delivering this message to the 275,000 truck drivers who were probably experiencing some of those same challenges that you described, Frank, about how do you maintain good exercise levels, not getting a stiff neck when you're in a cab all day, everything, the confinement, you go to a truck stop, the food is invariably pretty awful. So how did you do it? And imagine the power of nearly 300,000 hearing Frank's story and being part of that community. It's so powerful. And equally, we have so many people on our programs with chronic pain. And, it's Lee, none of us want anyone to experience what you've been through over that prolonged period of time. And it's a message that we hear. And when you get to somebody with chronic pain and we're able to help them to overcome it and manage flare-ups, but on the whole, really reduce down their pain levels, it is so profound for them, for their wider families, for the world. And you think, imagine your story now being shared across all the people. So chronic pain affecting 30-40%, depending what you read at the moment, of people. Imagine them having access to this is what I did. Now, you're one person's opinion, but the power in that means I'm going to listen to you and I'm going to do what's right for me. I'm going to do something about it. And so I think that is why us as a community, we're so valuable, is to get, as you said, Anthony, to get those messages out to people, because we believe it then. We believe it's possible. And that, I think, is so important.
Yeah, really powerful. And Lee's been in pain since he was 5 because he only looks 35.
I'll take that.
I love it.
Excellent. Okay, then.
Anthony, before we sign off, I've been fiddling around here trying to put a message up on the group chats, not the internal chat, and I can't see how to do it.
No, I couldn't either.
A message. No, I can't. I can see them. I can see the chat from listeners.
Yes, which one, I must admit, as a final thank you to everybody. Thanks for putting all the questions in and the comments. Really, really value them. And I've been trying to pull out the relevant ones that fit the conversation, and I've not been able to do everybody, obviously. But thanks ever so much. Is there a particular one that you'd like to pull up now, just to close us off?
No, I just want to thank them all because there is so much goodness here. So much passion, so much support. I wish we could have another session just having that conversation with each of you here. So I've just seen this one, but thank you all, and please all keep on keeping on.
Yeah, brilliant.
We need you.
Thanks everyone. Really enjoyed it as always.
Thank you.
Great
to meet you all, and I want to do this again.
Yes.
Really,
we will.